Bismillahirrahmanirrahim. My name is Safa Arshad and today's my topic is fish oil in human health. So fish oil and human health related to each other. Fish oil is a richest source of HUFAS, which is fish oil is a richest source of two essential fatty acids like alpha linolenic acid and alpha linoleic acid. Alpha linoleic acid is an omega-3 fatty acid, whereas linoleic acid is an omega-6 fatty acid. Fish is also a rich source of two pharmaceutical important omega-3 fatty acids like EPA and DHA. Our body make most of the fatty acids they need from the carbon, hydrogen and oxygen atoms that are found in food. But they don't have any way to create omega-3s and another type of fatty acid omega-6s. Both of these belong to a category called essential fatty acids and they come only from certain foods. The human can synthesize AA provided linoleic acid is available as a substrate but the human system cannot synthesize linoleic acid. Human body cannot synthesize ALA also. Both linoleic acid and ALA are not interconvertible. Thus, our diet should contain both linoleic acid and ALA. Our body can synthesize EPA and DHA from the precursors ALA but at a very reduced rate, less than 5% of the total requirement. Moreover, elongation and desortation of ALA is also affected by the competition from common dietary linoleic acid. Performed dietary EPA and DHA are far more potent than dietary ALA in changing the proportion of omega-3 fatty acids in platelets and plasma. That's why EPA and DHA has to provide it through diet. So, CHD3 separate phenomena associated with CHD, which is a heart disease, coronary heart diseases, and these are the three: thrombose, vascular spasms, and atherosclerosis. Thickness of internal wall of blood vessels by deposition of fat substances including cholesterols. And the second one is formation of aggregation of blood platelets and associated with material to block the flow of blood through the restricted coronary, more acute event. And vascular spasms, it is an acute event which can rapidly constrict the blood vessels and cause death of patient with localized death of the tissues. And CHD is responsible for the factors are elevated level of total cholesterol, LDL, and serum triglyceride. On the other hand, HDL is a scavenger of cholesterol and is inversely related with CHD. The body uses both types of omega to create a variety of short-lived hormone-like substances called. These substances perform many functions such as regulating blood pressure, controlling important aspects for the reproductive cycle, including blood clotting, among other things. Omega-3 fatty acids help preventing heart disease, angina, high blood pressure, high cholesterol, asthma, breast cancer, colon cancer, migraine, gout, and inflammation problems. And PUFA of omega-3 family synthesize 5 classes of metabolism which are collectively known as the autochores and econodes. And these are the following: PGI, TXA, LTA, LTB, LTC, LTD, and HETE. EPA are also produced above classes of autochores, but these differ from the metabolism of amino acids. EPA mediates physiological process by modifying the type and amounts of substance that are produced. And these are all the PGL2, PGL3, TX2, TX3, and LTB3, and leukotriene B2. Animal studies in various tumor models in general indicate that fish oil omega-3 PUFA has anti-tumor effect, and vegetable oils potentiate the thermogenic effect. And PGL2 produce omega-6 PUFA is a tumor promoting, while omega-3 PUFA reduce its production and concomitantly the growth of the certain tumor. Fish oil with EPA and DHA find as possible use in the treatment of the kind of a skin disease. and various studies have tested fish oil treatment for the symptoms of many kind of disease, and that can be as easily as in childhood. And these are the continue from the mother from the different types of cycles, stiffness and tender joints. And among us, PUFADH is involved in neural and retinal development. A diet imbalance in omega-3 and omega-6 fatty acid can be quite damaging to the PUFA composition of developing a human central nervous system. Special attention is required to ensure the presence of DHA in our formula devised for infant nutrition. When lack of omega-3 in pregnant mother increases baby's risk of impaired in verbal, social and motor skill development, and these are the very poor outcomes associated with insufficient intake of omega-3 fatty acid during pregnancy, including nutrients, growth retardation, adverse, and the many problems are occurred during the pregnant mothers. Production of EPA and DHA concentrates. Hull and Grimsey Limited UK in 1960 marketed a product called Ethiv with 26% EPH and 22 DHA prepared from a cod liver oil. At present, many leading pharmaceutical concerns of the world are manufacturing and marketing EPH and DHA concentrate in capsule form with the nominal concentrate of 1 EPA or 1 DHA per triglyceride molecule. Enrichment of triglyceride without an interesterification or resynthesis is not practical beyond 30 gram, 300 milligram over gram. Okay, a concentrate with more than 300 milligram over gram of EPH and DHA is possible by the urea complexing of ethyl ester of the fatty acid. So separation of the PUFA from the urea complexing method, we will discuss about urea complex method is in this slide. To extract and purify polyunsaturated fatty acid, the first one is and practically EFA and DHA without cis transconversation of form naturally occurring oils such as a marine, animal oil and various vegetable oils or mixture of the free fatty acid in first extract from the oil. Then the resulting mixture of pure fatty acid is then subjected to separate by means of urea complex into monosaturated fatty acids and most monosaturated fatty acid. Remaining solvent and urea are then removed from the filter, which is then subjected to low temperature fractional crystallization in the presence of any organic solvent such as acetone. And the fourth one is substantially pure polyunsaturated fatty acids, especially PA and DA, which can be separately precipitated by reducing the temperature of the filter in 2 steps. Alternatively, the volume of the filter is reduced in 2 steps and cooled to form precipitate, which are removed. The final product is a mixture of substantially pure DHA and EPA. This is the flow sheet diagram and a method for separating of a substantially pure mixture of acid and EPA and all ZACDHA from marine animal using only reaction conditions sufficiently mild to avoid degradation of the EPA and DHA, consisting and essential of the steps of following method. Extract a mixture of polyunsaturated free fatty acids and mixing sad fatty acids are ester with urea and polar organic solvents. And third one is removing the precipitate which form after sad making steps and recovering the filter. Removing remaining solvent and the urea from the filter to obtain pure fatty acids or esters. Forming a solution by dissolving the pure fatty acids or ester in an organic solvent. Gradually cooling the solution until a first precipitate form and removing said first precipitate, and then remove sufficient solvent from the filter remaining after the precipitate is removed to substantially reduce the volume and increase the concentration of the solution, and then gradually cooling the solution until a second precipitate form and removing second precipitate. The first one is in step 6 and the second one is in step 8. Remaining sufficient solvent from the filter remaining after the second precipitate is removed to substantially reduce the volume and increase the concentrate of the solution, and then gradually cooling the filter until a separate liquid or solid phase forms and removing said separate phase and retaining the remaining liquid phase containing a mixture of substantially pure EPA and DHA. Now in this way we can get the pure EPA and DHA, and after that we are discussing about its packaging of EPA and DHA concentration. To protect the oil or concentrate against oxidation and to retard of flavor formation, it is indispensable to stabilize by using permanent antioxidants, storage under nitrogen at low pressure, protection from light. Soft gelatin capsule is an ideal and stable container for fish oil or EPA and DHA concentration in small amount required for human consumptions. Omega-3 fatty acids also control or prevent the following condition: control of body weight, cholesterol level and high blood pressure, mental depression, preterm labor, and glaucoma. According to the general recommendation on dietary fats of a human consumption, the diet should supply 0.8 gram EPA and DHA per day. With fatty acid like oil, sardine, and 100 gram serving may provide both 3.2 gram of EPA and DHA, but for the white pomfret of India, it may be low as 0.083 gram. Regular intake of fish oil or EPA and DHA concentrate in the form of capsule may ensure a regular supply of omega-3 fatty acid requirement of our system. Good source of omega-3 fatty acids are following: salmon, herring, bluefish, rainbow trout, and swordfish. Possible side effects and cautions of the these following: increased bleeding time and possibly resulting in noticeable and easy brushing, and may cause upset stomach. And also do not take if you have a bleeding disorder or uncontrolled high blood pressure. Take anticoagulant, blood thinner, or use aspirin regularly. Are any allergic to any kind of fish? Take fish oil, not fish liver oil, which is highly in vitamin E and also in vitamin D. That may be toxic in a high amount. And also people with diabetes should not take fish oil because of its high fat content. And this is all about fish